Come to order. Today we meet to discuss the year ahead for healthcare in America. Thank you, Secretary Becerra, for joining us. I'm going to start off, colleagues, with a little bit of history. Topic 1, drug prices. In July of 2020, Donald Trump said, and I quote, "Since the day I took office, I have made reducing drug prices one of my highest priorities." For 4 straight years, Donald Trump complained about high drug prices, did lots of finger pointing at others about the problem, and repeatedly talked about how he was the best friend seniors who depend on Medicare could have. What was actually accomplished over his 4 years? Exactly nothing. Fast forward to the Biden administration. From the time Joe Biden took office, President Biden made it clear that he was committed to lowering drug prices and health care costs for families. I remember him having a conversation with me shortly after his election, and he said, the Finance Committee is the place where things happen, and everybody's been talking about doing something about drug prices forever. Now it's time to get something done and to actually help seniors. Not just talk about it, because there's been plenty of talk, but actually get results that provide real pocketbook relief to seniors and consumers. 2 years later, President Biden, because Senator Stabenow and many colleagues who are on this side of the aisle worked very hard to get results, to lower prices on medicine, and President Biden signed the Inflation Reduction Act into law. For the first time under the law, Democrats and President Biden gave Medicare the authority to negotiate better drug prices. And understand what that means. It means that seniors beat Big Pharma. Big Pharma's holy grail, what they cared about more than anything, is prohibiting negotiation for a better deal on medicine. Look at what they're doing right now, going to court, trying to stop any negotiation. But we got it written into law that there was going to be negotiation. And on top of it, most Americans have access to free vaccines. Insulin costs for seniors were capped at $35 a month. And as we said, Senator Stabenow and I talk about it all the time, you know, when the government leads on these issues, particularly the showpiece of American healthcare, Medicare, almost always the private sector copies it. And so we've seen some real progress in the private sector as well. Not as much. We want everybody in America to get that pricing relief, but we're making real progress. We also created price gouging penalties for the first time to hold Big Pharma accountable for high drug costs. Those are already benefiting patients and taxpayers. Plenty more to do. For example, it's essential that finally, after all this debate, we get pharmacy benefit manager or pharmacy benefit management reforms across the finish line, and the Congress finish this crucial change that's going to help all these wonderful people in their white coats, because they're here to keep the small pharmacies going and to lower drug costs for patients and protect community pharmacies. So that's the difference, folks, on the first issue, drug prices. Donald Trump, President Biden. Topic 2, health insurance. In March of 2019, Donald Trump tweeted, "The Republican Party will become the party of health care." With the help of Senate Republicans, his #1 health care goal, stated again and again, #1 goal, repeal the Affordable Care Act. Just get rid of the whole thing. On that one, he failed, fortunately, as well. Under President Biden's leadership, Democrats boosted tax credits for health insurance, saving millions of Americans an average of $800 per year on their coverage and expanding access to care. So when you look at President Biden's health care budget for the upcoming year, what you see is a clear focus, which is to build on the progress that the Biden administration has made. So with all these healthcare challenges in mind, the next question is, what do Donald Trump and Republicans have planned when they talk about healthcare? The American people are wondering, because not once during the ACA repeal and replace crusades, not once did we see an actual replacement. 7 years after the effort to repeal the ACA crashed and burned, nothing has changed. Donald Trump still says, let's get rid of it. He still lacks a plan to take care of all the people whose health care coverage his doing that would actually rip away. And now, apparently, he's even talking about gutting Americans' hard-earned Social Security and Medicare benefits. No plan to keep seniors out of poverty and illness either. So that's the difference, folks, between what Senate Democrats and President Biden are talking about and what Donald Trump is talking about. The Republican health care plan is shred the programs that exist today that countless Americans rely on and just pretend everything's going to be fine. So on these issues, I think it's clear that there is a gap between President Biden and Senate Democrats and Donald Trump with respect to health care. The gap between those Trump promises and Biden action on health care, the difference on the actual record between the two is as deep as Crater Lake. Democrats made promises to the American people, and we got results we delivered. And I'm going to wrap up by saying there's another issue today that's pending that's very important for kids and health care, and that is to get our bipartisan tax deal with Congressman Jason Smith passed in the Senate. You'd help 16 million kids and immediately lift 400,000 kids out of poverty. Now, you don't have to take my word for this. Here's what the president of the American Academy of Pediatrics had to say about this. By the way, in case anybody's interested, he's from Oregon. Dr. Ben Hoffman, a doctor at Oregon's very own Oregon Health Sciences Center, and I guess his night job is president of the Academy of Pediatrics. He has said, and I quote here, there's an inextricable link between poverty and child health. An inextricable link, folks, between poverty and child health. What we're trying to do, that got 357 votes in the House of Representatives, is help those 16 million kids be healthier. And 400,000 of them would get out of poverty right away. So we want everybody to know this morning we are all in terms of getting it done. We want to pass that bill, the child tax credits and help for companies with their research and development before the April 15th filing deadline. So, hearing from the American Academy of Pediatrics as we wrap up this discussion, as far as I'm concerned, is about as good as it gets. But we're still going to have some more very good input today from Secretary Becerra about how President Biden is going to continue to lower costs and improve care for more families. But